Hi, this is Dr. Nick, and I'm the incrementalist. I'm here talking to Billy Rios from Whitescope.
Yeah.
Billy, thanks for joining me today.
Yeah, thanks for having me. Appreciate it.
So it's an exciting time in the healthcare perspective for the piece that you're talking about here at Blackhat.
Yeah.
Tell us a little bit about that presentation.
Yeah, we're going to give a talk on pacemaker systems, and the beginning of the talk is essentially going to describe how these systems work, just giving you an overview of the various pieces of it, like the actual implanted devices themselves, the pacemaker programmers, the home monitoring systems, software delivery mechanisms and update servers, things like that. And then we're actually going to talk about some vulnerabilities that we had discovered in various components of this ecosystem. And then we're going to talk about the disclosure process that we had with the manufacturer. When I say disclosure process, that is the mechanism to which we provided the details of the vulnerabilities we discovered to the affected manufacturer.
So there's a little bit of history to this. You've had a personal intersection with the healthcare system that led you to a little bit of an enlightenment and a focus here. Tell us about that, if you would.
Yeah, I mean, many years ago, I went in to see an ENT because for some reason I just started snoring really loudly, and the wife insisted that I go and see someone about it. And I told her I was just, it's just old age and weight gain. But, talking to the ENT, he said, hey, you've got a polyp in your nose. And so he said it's an outpatient procedure. He removed it. And then my nose started dripping, and it just wouldn't stop. And so I went back in, had a fever, felt really groggy. Didn't want to go back into the hospital. My wife actually made me go back in, and when the ENT took a look, he knew right away it was a CSF leak. So apparently, many years ago as a young man, I probably broken my nose or had some trauma that never got properly fixed, and that polyp was actually essentially sealing up a rupture I had in my dura. And so as soon as the ENT saw this, he knew right away I had to go into surgery. So the next day I'm in surgery, and I wake up, and what should have been a pretty easy, straightforward procedure became pretty complicated just due to the amount of scar tissue I had in my nose and things like that. So I found myself laying in a hospital bed for a few weeks, and being a cybersecurity professional, you start to see all these connected devices around you. So the infusion pump that's giving me my antibiotics, the patient monitor that's hooked up to my, monitoring my heart rate, the centralized information system for the nurses to figure out whether I'm moving around or something's come loose. The bed that I'm laying on is connected, I remember opening my phone up and seeing, 8 to 10 different Wi-Fi access points for infusion systems, patient monitoring systems, and this and that. And I'm like, man, modern hospital is a pretty connected system, right? So became pretty interested in looking at some of these medical devices in, really, really detailed in a technical way. After that, started buying a lot of devices on my own, just kind of as independent research and looking at the security vulnerabilities associated with them.
So you've essentially identified, in this instance, a specific vulnerability. It's around a device. It's pretty significant, right?
It is. I mean, the talk talks about vulnerabilities. It's not just one. It's about 10 different vulnerabilities we've discovered in various pieces of this pacemaker ecosystem. So in the patient monitors, the home monitoring systems, in the pacemaker programmers, in the software delivery network. So we're going to talk about all the vulnerabilities that we've discovered. We also have some vulnerabilities in the insulin pump systems that we looked at as well. So it's not just one, it's actually a variety of them.
So as you think about this, both as a perspective of a patient, so you're at risk if you're on the receiving end of this, and as a security researcher, what advice would you give to the clinical community as they start to wake up, I guess, to this incredible edge of vulnerabilities to devices that are not just about security or a camera or the fridge. This is about life and death. What should they be thinking?
I think to the clinical industry, like physicians and doctors, one of the most frustrating pieces about this whole disclosure process is there haven't been very many doctors or physicians involved at all. So it's been conversations between the security researchers, which is us, the manufacturers, and a regulator, and everyone is kind of pretending like they know what they're talking about. But at the end of the day, the people who know the patients the best are the clinicians, right? And so, but their voice is never represented in any of these conversations. So I know that the FDA is trying to create a structure, an analysis board that makes it to where the physician voice is heard in these types of situations. But I would say don't wait for that to happen, right? So in these instances, physicians should be involved, right? So if there's vulnerabilities in a particular product, a researcher shouldn't be telling you what the risk to the patient is. A manufacturer shouldn't be accepting risk for a particular vulnerability. The physician should be determining what the risk is to their patients and determining whether or not that's acceptable or not. And that's not happening right now.
So I think I would pull out of this the incremental step for the healthcare community: get involved in security, be participants up front, and include that as part of your ongoing thinking process. It shouldn't take a security researcher lying in bed looking at the exposure that we have to bring us to the realization that we have to focus on.
Right, exactly. Make your voice heard. I think, from the security research perspective, we are well represented, right? So, and we can make our voices heard. That's exactly what we're doing here at this conference. And then the manufacturer is going to have their voice heard through press releases and things like that. But the clinicians need to make their voices heard as well, right? So don't allow a manufacturer to accept risk for you. Don't allow a researcher to dictate what patient safety risks are for you, right? The physicians know the patients the best. They know how these systems actually work in the real world, and they're probably in the best position to understand what the real risk is. It's unfortunate that we don't have their side of the story in any of these discussions.
So important from the clinical community, make sure you get involved.
Definitely.
Before we finish, I think it's worth just sort of putting things in perspective, and I know that that's an important aspect to this. So from a concern for patients who are obviously going to look at this and say, oh my God, what would you say to them?
I mean, the first and last slide of our presentation is that we still believe that the benefits associated with connected devices outweighs the risk. And we say that as researchers, like looking for vulnerabilities, writing exploits for vulnerabilities in these devices. So with that said, there still is a responsibility from manufacturers to do the right thing. If there is a vulnerability in a product that could be used to hurt someone, they should fix it, right? They shouldn't accept the risk on behalf of a physician or a patient. They shouldn't spend all of their time creating PR talking points and trying to talk around the risks of the issue. If it's a simple engineering fix the bug, right? And then we don't have to worry about whether or not it's worth accepting or not or anything like that. The risk will have been eliminated.
So the highlight here from a clinical perspective is the benefits outweigh the risks. These solutions are important. They're an important aspect of our armory to treat diseases. But we cannot ignore this problem, and the clinical community needs to get involved.
Yes, I agree with that, definitely.
So Billy, I just want to thank you for joining me. We're here at Blackhat, excited that you've brought this to the fore. Thank you for sharing some time with us and your insights.
Yeah, thanks for having me. Appreciate it.
I'm Dr. Nick. I'm the incrementalist. Don't let perfection stand in the way of progress.
Awesome.